Okay, now let's look at the female model. And it's a little hard to see. Remember, this is three-dimensional. So this is actually on the right side of the pelvis. Okay, so you're seeing the, actually, from, if you were putting this in anatomical position, you would be seeing the left ovary. Okay, so this would be the left ovary. So you're seeing the ovary here. The ovary is where the egg is made. And then this little red part, the red on the end, it's rather hard to see, but what you are seeing is something called fimbria. And the ovary and the fallopian tube are not actually attached. So these fimbria, their job is to kind of create a pulling motion so that when the egg is released from the surface of the ovary, it is drawn into the fallopian tube. So we're seeing the ovary, then the fimbria at the end, and then this is the fallopian tube. All right, so our fallopian tube comes in here. It's a little hard to see what is actually happening. So let's open this up. And once again, let's get oriented to where we are. So this is the rectum and the anus. There's our pubic bone. This is actually the bladder. All right, and we'll talk about that in just a second. So as you're looking at this now, it's a little hard to see, but if I tip it just right, and you got to flash for a second, what you're seeing back here is the other ovary, is the right hand ovary, the fimbria, and you're getting a better view of the fallopian tube as it comes into this structure. This structure is the uterus, and that's where the baby or the fertilized egg will implant and develop. Okay, so there's our uterus. And so I want to now look, obviously sperm has to make its way through, this is called the cervix, here's the vagina here, and this is the neck of the uterus. That's called the cervix. The term cervical, we actually use it when we're talking about the neck as well, and the vertebrae in the neck are called cervical vertebrae because they are in the neck. So cervix means neck, and that's the neck of the uterus here. All right, so sperm have got to make their way from the vagina through the cervix up through the uterus, and then they have to continue on up into the fallopian tube, and up in the fallopian tube is where they will meet the egg. Okay, in order for fertilization to occur. That fertilization is going to occur within the fallopian tube, and the fertilized egg is going to start developing, and it's going to move down into the uterus where it's going to implant in the lining. When it implants in the lining, that's how the pregnancy continues. All right, and that's where the baby is going to get nourishment from mom. I want to come back here and let's take a look here. Here is the urethra in a female. Okay, notice compared to a male, it is significantly shorter. One of the reasons that women get significantly more bladder infections is the difference in length in a male urethra and a female urethra. There's a lot longer path for a male to get bacteria up into the bladder than for a female. Okay, so if that's something you have a problem with, then it's always suggested that you urinate more frequently, and that flushes the bacteria that may migrate up toward the bladder out, and certainly after sex, you should be making sure that you empty your bladder. Okay, so the other comment I have to make is if you compare the size of the bladder here with the male model, that is really not a good representation of the sizes. They're actually very similar in size, even though it would not appear this way. And I do have to laugh because I'm sure my husband envisions my bladder this size and his the other size, because I always have to stop when we go on trips. But that's beside the point. There really isn't a significant difference in the size of a male bladder and a female bladder, even though the model here makes it look different. So you should be able to identify those features on the model for the quiz.